What I want to give to you today is just a modeling of exactly the conversation I would have a patient that comes into my office right before we adjust them. So I would just say, Mrs. Smith, at this point, what we're doing is we're ready to go and get you adjusted. To get you adjusted, we're going to do some work that's called KST, and it stands for Koren Specific Technique. And it's based on what I told you earlier at the poster, that everything your body needs to do is controlled through the nervous system. Your brain talks to the body talks back to the brain. That's all controlled through the nervous system. Well, with KST, it's even a little bit deeper level than that. Understand that everything, absolutely everything that your body needs, your body knows. There is nothing that your body isn't aware of, and it has to for us to stay alive. If you inhale a virus right now, your body knows it's a virus because it has a different response than if it was a bacteria. If you put something into your mouth, your body would recognize it, whether that's a poison or a food, and what to take out as nutrition, what to pass on as waste. If you cut yourself, your body knows where it cut, how deep it's cut, and how to heal that. It has to. Everything that your body needs, your body knows. And KST is a way to get out of your body what your body knows for itself. And we do that by using what's called an occipital drop check. An occipital drop check is a binary feedback loop, ones and zeros, ons and off, yes and no. And what we use is what's called an occipital drop check to get out of the body that check, and it's a no and a yes response. And it works a lot like a lie detector test does. With a lie detector test, they hook you up to electronics, ask you yes and no questions, and they measure that physiological change on a machine. Well, with KST, instead of hooking up electronics to measure that yes and no response, we feel for that with again, this occipital drop check. And what we'll be doing then is checking on the back of your head, and we'll ask the body a question and then feel, is it no or is it yes? A no will stay even, a yes drops low on the left. And so we're just going to go through an entire series of questions to get out of your body what your body knows needs to be adjusted. Those yes and no questions we're going to ask you, I'm going to start out actually asking out loud so you'll get a feel for how that process works. After that, I'm going to actually kind of shut up and go through the questions quietly. And that's part of the thing with KST, and I don't have all the answers exactly how that works, and I've seen the quantum physics and all those pieces, but bottom line, we can either ask the questions out loud or I can think through them, and it works exactly the same. But I want you to at least know the process that it's going to be, that we're going to get that information out of your body. So what I'm going to do is I'm going to have you stand here, I'm going to have you face that way, and we're going to start doing these checks to see exactly what your body needs. That's my explanation. And for the vast majority of people that ever come into my office, that's all they ever need to know. They will stand there, they'll face that way, and we can start doing the occipital drop checks, and they get it. So I hope that helps you, and perhaps you can use that to get it so it would be something that you could utilize to better help your patients understand how to explain this so they understand it and would be more accepting of the process we're going through. Thanks so much.